Hi guys, so today we're going to do one of our controlled articular rotations. I'm just doing an updated video for your knee CARs. The key focus with controlled articular rotations is that we actually really go to the end range super slow and controlled. We're tensing all the tissue around, so we're radiating and tensing and contracting the muscles around your joint, and we're trying to control the motion. We're also trying to seek end range. So we're trying to go to whatever your end range is, and we want to try and go to the limits in rotation, flexion, extension, all the range that you have. It's also teaching your brain about your health and your normal motion. So for example, if you're someone who has knee arthritis, this is a perfect exercise to do, because what this does, it actually teaches your brain we can move, it down-regulates the pain receptors and up-regulates normal healthy motion. We can't get rid of your arthritis, but we can make your joint work better and feel better. So what we're gonna do is we're gonna do this simple controlled articular rotation. I would tell anybody that has knee issues, you do many of these in a day. Listen to your body due to tolerance, but actually more repetitions, small ones throughout the day is better than doing one set of 20 or something like that, okay? So we can do it seated. You can also do it seated in a chair. I'm seated on the floor, but if that's too hard, absolutely sit in a chair or in a bed or anything like that. Supported with a back if you need it, okay? So the first one is we're gonna take our hand, we're gonna pop right underneath. So I'm going all the way. This is the hardest version. Then I'm gonna grab my other arm on the upper arm and back over. So this locks it in. So now I can't get away or use other motion. This is really good. So we're gonna rotate and pull our toes up. So we're dorsiflexing our toes up towards us and rotating the tibia or shin out as far as it can go. Then we're gonna slowly extend to our end range of motion. We're gonna try and rotate inwards, so tibia is coming inwards. And as you come down, keep coming inwards, trying to eke out more motion. We then rotate back out, extend or straighten the leg to our motion. You're gonna feel stretch in the hamstring, absolutely normal and good. Coming down and in. And to reverse that motion, we stay exactly where we are and we just reverse from here. So we freeze, keeping our foot rotated in and upwards, straightening, rotate that tibia outwards, coming down and in. So I'm tensing, maybe 30-40% tension and down. If I show you from the side, we're gonna be in our side here. Arm goes underneath, grabs that upper arm, comes over. This is like a Kimura move. We're straightening and coming inwards, coming down, rotate that foot out and up, straightening, in, down. What we're feeling for is motion and rotation at the tibia or the knee here. So we want the tibia to move relative to your femur. So it's rotating inward and outward. To modify this, I always tell people, you can just grab your arm, your leg, and go further down. So same exercise. You could even hold it fully down and just do it against the floor. There's one last modification that I like to do. So some people, even holding the leg is a bit too hard, or they struggle to find tension. And this one works really well for that. So what you do is you're gonna do the same thing. You can do seated on the floor or on a bed or something. We're gonna have our knee at around 90 degrees or so. I'm rotating the tibia outwards and keeping our toes up. And then we're gonna push. So I put my hands on either side here. We're pushing along the floor, move my other leg out of the way, straightening the leg. We're gonna rotate in, and as we come up or bend the leg back in, we're gonna keep rotating in into our end range of flexion and pushing out. And so to create tension, you can push your heel into the ground, coming up. And then if we're gonna reverse, we're here and we're gonna reverse by going all the way out, rotating out, coming in. Try doing 6-8 reps of that knee CARs and see how great your knees feel. There's a few modifications in there and let me know how it goes.